A new study on ivermectin shows the drug does not reduce hospitalization from COVID-19 infection. That's according to a new peer-reviewed study published on the New England Journal of Medicine.
Yeah, you might remember the anti-parasitic drug gained popularity in some circles as a treatment for COVID-19. But the study found ivermectin isn't effective in battling COVID like many anti-vaccine advocates promoted.
This is the subject of a new opinion piece on MSNBC.com by NBC News medical contributor Dr. Kavita Patel. She joins us now. Dr. Patel, always great to have you with us. So tell us more about this. So in this op-ed that you wrote, you say this drug is part of what you call a business of lies, and it's both winning in America, but then also costing people their lives. Explain to our viewers what you mean.
Yeah, good morning, Savannah and Vicki. And I started by just trying to look at the science. If I'm a doctor, that's what I do. But as you unfold it more, first of all, the first dozens of studies were refuted or were not of high quality. And then as you dug deeper into it, you started to see that there were doctors who were actually kind of excommunicated from their hospitals, their medical groups, their peers. But these were the same doctors who were putting up these telemedicine front doors that patients who were desperate would pay cash, some as high as $200 a call to get a prescription. One doctor could bring in millions of dollars and did, all when at the same time, Savannah, we had vaccines that were starting to be launched and other treatments like remdesivir and monoclonal antibodies that showed way more promise. So it's a little bit of an onion that I kept unwrapping.
And we talk about this new research, Dr. Patel. It shows, obviously, the ivermectin doesn't reduce hospitalization for COVID. That was just published. But in a lot of ways, do you think the genie is already out of the bottle? You know, it happened. People took the drug. Maybe it worked, but it didn't work for them. Looking to the future, how do you combat misinformation in the medical world before it takes hold? Or is this going to continually be a debate for people on what they believe?
Yeah, Vicki, I think it's going to continually be a debate. I think it's going to be people like the three of us who have to prioritize bringing the science forward. I think we tried to do that, but we need to reach people where they're getting the misinformation. You know, just putting things out in like nice CDC reports and peer-reviewed journals that only a handful of doctors read is not cutting it. So we have got to figure out how to get that information into the public's hands in an accessible way and in a health literate way. Not everybody can read efficacy and double, blinded and randomized control. You need to understand how to judge evidence when in life we only have a couple of minutes to do it.
Yeah, absolutely. I want to read a little bit of something that you wrote here in prescribing this drug. You said, a cottage industry has since developed with millions of dollars flowing to telemedicine companies who offer sympathetic videos that seem reasonable with no discussion of risks or benefits. I think that's such a key part here, that seem reasonable. People see the title doctor. People see it maybe shared by their friends, somebody from their church. What needs to happen to get this under control? I mean, Vicki just used the expression as the genie out of the bottle, but like, how do you change this when so much of misinformation just comes down to, oh, well, I choose to believe this because this person's a doctor?
Yeah, that's right. And so there's a lot of regulatory things that can be done. Look, we don't want to suppress freedom of information or freedom of speech. We want patients to be able to talk to people, doctors with various opinions, but we need to get down to the facts. So I think what's really important is kind of this marketing that's happening for ivermectin, hydroxychloroquine, for vitamins that don't work for patients, but they take millions of dollars. We need to be able to have kind of a consumer protection like we do for credit card scams and for other things for these types of direct-to-consumer available medicines. That would be one step.
Yeah,
there's a Kavita Patel.
Yeah, I was just going to say there's a difference between misinformation and free speech and giving people reliable sources so they can make a judgment.
Especially when it comes to your health and something you're going to be putting in your body, ingesting, shooting, whatever. Dr. Kavita Patel, thank you so much, as always. We love when you join us. And you can read that full opinion piece right now on MSNBC.com.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.